Hello everyone. Welcome to another episode of USTM Podcast. I am your host Mehzebin, and today we are going to discuss on a very vital topic that impacts countless life, that is women's health issues. Today we have with us Dr. Dubori Deka, consultant gynecologist from PA Sangma International Medical College and Hospital. Welcome to the show, ma'am. Dr. Deka, to start with, can you give us an overview of one of the most common health issues that women are facing nowadays, that is PCOD? So nowadays PCOD is so common. So why this is so, and what are steps that we can take to decrease these kind of incidents?
Thank you, Mehzebin, for inviting me. It's my pleasure to be here today. Nowadays PCOD is very common. PCOD means polycystic ovarian syndrome or polycystic ovarian disease. Now this disease is very common in urban areas. Its incidence is less in rural areas. Why? Because of the lifestyle. Because in villages, women go for physical activity, they consume home cooked food, then their lifestyle is a bit different from city women. But in city, the women usually have a sedentary life habits. They prefer junk food rather than home cooked food, less physical activity. So all these predisposes this hormonal imbalance. What happens in PCOD? The ovaries start producing a male hormone. So there may be increased history of weight gain, there may be obesity and acne formation, increased hair growth, there may be menstrual irregularities, there may be infertility in young couple. So these things actually can be prevented by lifestyle modification. Lifestyle modification plays a very important role in PCOD. Though we prescribe medicines, but we suggest that you should go for exercise, day-to-day exercise like brisk walking, running, swimming, any kind of sports, then do yoga, go for gym, then take home cooked food. Once in a blue moon, junk food is okay, but not on regular basis. So go for home cooked food. So lifestyle modification, in short, plays a very important role in prevention of PCOD.
Ma'am, we often hear about the importance of regular health checkup. So what are the screenings that are available for a woman that she should go through at her different stages of life?
Yes, it is very important for screening or regular health checkup for a woman, because many diseases get unnoticed, and many instances like sometimes what happens, a woman is not aware of her health condition, or a woman is aware but she takes it very casually, or she may be very busy in her day-to-day activities. So what happens, if she goes for regular health checkup, many undiagnosed disease may comes out in her blood reports, in her ultrasound, any kind of investigation will detect the disease. Say for example, ovarian cancer. In case of ovarian cancer, what happens, initial stage is very asymptomatic. When it produces symptoms, it is already in her late stage. So in such cases, if she undergo regular checkup at a regular interval, this kind of disease can be diagnosed. And once we diagnose any diseases at its early stage, definitely the prognosis is very good.
Okay, so ma'am, this brings a very important and very interesting question to my mind. Generally, what kind of patients do you encounter in your OPD, specifically talking about Meghalaya and Assam?
See, there are different kind of patients come to our OPD, starting from young girl to elderly woman. So I will come by stage wise. When a teenage girl comes to us, she might have menstrual irregularities, painful menstruation, and very common nowadays, PCOD, and also endometriosis. So this kind of patient usually comes to our OPD. Then coming to the young women, they have like menstrual irregularities definitely, and married couple often comes with infertility. Then any kind of tumor, like tumor of the breast, it may be benign, malignant, then tumor of the ovary. They are not very common, but they also come to us. Then in a later age group, like premenopausal or postmenopausal, they comes to us with menstrual irregularities, then history of irregular bleeding, excessive vaginal discharge, itching, abdominal bloating. So in such cases, we take proper history and do proper investigations to find out the cause. And last but not the least, some patient that is mainly from village areas, they come to us with a specific term that is called uterine prolapse. What happens in this condition? The uterus comes out from the body. It is not in the normal position, and those patients are generally coming from the village area. What I have found is in Meghalaya, maximum patients have anemia, and they take it very lightly. They take their health issues very lightly. They have anemia, they have prolapses also. So why this prolapse occurs? Because of the lifestyle again, because there are so many childbirth, then they go for physical activity, just giving after a childbirth, then home delivery. So this causes this uterus to prolapse from its normal position. What happens? The muscle becomes lax, so they could not hold the uterus in proper place, so it comes out from the body. Definitely it can be curable. The surgery is the main treatment. So this kind of patient comes to us, and yeah, anemia is very common. I have found that many pregnant patients, yes, definitely the pregnant patients are very common in our OPD. Now, this pregnant patient, invariably, most of the pregnant patients are anemic. Either they are aware of that, or they even if they know also, they don't care. They take it very casually. They have multiple births. I have seen them. They have multiple births. In Assam also, the patient have anemia. Yeah, patient have anemia, and these menstrual irregularity patients are very common, and very common PCOD patient in teenage group, young women. Endometriosis patients are also very common. So different kind of patients comes to our OPD. Then definitely pregnancy patient are more common than the other gynecological patient.
Okay, so that was really insightful. As we all know, like pregnancy, it is such a special and considered to be as important phase for any women. So, what do you think? How many checkup should a woman do during her pregnancy?
See, first of all, I would like to say that pregnancy is not a disease; it is a physiological phenomenon. So, once a patient becomes pregnant, she should immediately consult with a doctor. She should come to any health center or hospital as soon as possible. She should come. So we take that visit as a first visit. Then after that, she should come at a monthly interval till 32 weeks, that is 8 months of her pregnancy. After that, we ask her to come every 15 days interval. And when in the final stage, that is on 9th month, so in the 9th month onwards, she should come every 1 week interval, because that period is very crucial and decision making period. So we ask her to come every week interval. Now from beginning, actually, and I would like to say one more thing, that ultrasound, we should go for at least minimum 3 ultrasound during her pregnancy. Number one is when she comes to us, like first visit. Then in that case, we go for ultrasound, that is early ultrasound. Sometimes what happens, pregnancy occurs outside the uterus also. So it is a life-threatening process. So in that case, we should know whether her pregnancy is within the uterus or outside the uterus. Then whether it is a viable pregnancy, fetal heart rate is there or not, whether the baby is beating, heart is beating. So in those things, we definitely it is very helpful that first ultrasound is very helpful in those cases. Then second ultrasound is the anomaly scan that is done in between 18 to 22 weeks of her pregnancy. Now this ultrasound gives an information of any anomaly of the baby, any abnormality, any kind of deformities, so that we can abort the pregnancy. Then the final ultrasound, during her late stage of her pregnancy, that is 9 months, that is a decision making ultrasound, whether she can go for normal delivery or she might need cesarean section. So this kind of decision we take from the last ultrasound. Now these three are mandatory, but in certain cases we go for some more ultrasound, like if there is certain problems like bleeding, then draining, then decreased baby movement, then history of fall, and any kind of, there are so many things. So then we can go for many more ultrasound, but these three are mandatory. So antenatal checkups plays an important role. So she must come. We can diagnose, we can detect if she has some medical problem, if she is anemic, if her BP is low or above normal or below normal. So these things are diagnosed only when she comes to us. Then only we can detect, and thus we can cure.
Another scenario that is very common today is infertility. So, ma'am, why do you think it is very common nowadays among the ladies that are dwelling in cities?
Yes, this is a very interesting question. In cities, because of the lifestyle, like nowadays, what happens? Young woman gets married after 30, usually, because of the late marriage culture, long distance relationship, work culture. All these play an important role in infertility. So these are the social causes, but there may be certain other causes also, like health issues. Again, I would like to say PCOD, again hormone related problem. Then again you can say endometriosis, which is again common in cities. This PCOD is also common in cities. So these play a very important role in development of infertility. So many patient comes to me at their very young age group. They have PCOD or they have endometriosis. So in later life, when they get married, they will develop they may have infertility problem. So in cities, the infertility is very common, and definitely there are other health issues also. There may be hormonal imbalance, there may be some problem with the uterus or ovaries or any other health related issue, but these plays a very important role of developing infertility in city areas. In rural areas, we can see early marriages. They stay together at home, their physical activity, less incidence of PCOD, less incidence of endometriosis. So that's why infertility is less common in villages and it is more common in cities.
Finally, Dr. Deka, what message would you like to share with our audience, especially the women's, about prioritizing their health issues?
Action.
Yes. What I think that a woman plays a very important role in our society. A woman must be educated, well educated. If a woman is not educated, at least she should be aware of her health and health related issues. She must know what is normal and what is abnormal. She should know her body, what is if there is something going wrong, she should detect it in a very early stage. She should not feel shy. She should come forward, discuss with her close relatives, and definitely consult with a doctor. Definitely, if every woman are aware of their health and health related issues, it will definitely has a significant role in decreasing the morbidity and mortality from the society. Thank you.
Thank you so much, Dr. Deka, for sharing your expertise with us today. I'm sure that our audience have gained an insight about women's health care and the importance of taking proactive care.
Thank you. It's my pleasure.
Excellent.
And to our audience, thank you for tuning in with us. We will see you in the next episode of USTM Podcast. Until then, stay healthy. Thank you.